and for related matters, standing in the name of Honorable Dickson Tarkighir. Honorable members will recall that the bill was read the first time on Wednesday, 16 November 2015. I now invite Honorable Tarkighir to move that the bill be now read a second time.
I remain Honorable Dickson Tarkighir. I represent Makodi, Goma Federal Constituency. Mr. Speaker, I'm from Benue State. The Speaker, I rise to propose a bill for an act to amend the National Health Bill 2014 to include free and compulsory periodic medical tests for prevalent and chronic ailments on all persons living in Nigeria and other matters thereto. I so move. A bill which sole aim is to canvass a national effort towards early detection of chronic medical ailments. Early detection has a plethora of advantages, and all medical personnel are united on this. The assertion that early medical detection is beneficial to everyone is therefore a fact. The bill is based on the undeniable fact that all ailments, when detected early, are cheaper to treat, easier to manage or to cure for those with a cure, being cheaper, easier to manage, better chance for cure, less suffering for the patient, more likelihood that the patient would seek appropriate and timely help, all in line as positives to early detection. The column for the negative is blank. Why is this matter a legislative matter at all? Well, Mr. Speaker, honorable colleagues, the cost of healthcare has continued to rise all over the world. This holds true for our country as well. As we are aware, even for the most advanced nations with fully developed healthcare reforms, complete with insurance measures, the best way forward on healthcare has remained as elusive as it is totally divisive. Most of the times, along partisan lines, entire 48 years of tenures, administrations are tied to how best to solve healthcare, and even in the United States of America, that often pop up as the ready example of a system that works. We can hardly boldly go to their example in this field with the hope of solving healthcare problems, or more appropriately, preventing a major healthcare chaos in our costs and epidemics that quite fearfully seem inevitable, especially as our population continues to geometric sprint to explosion. Currently, our country is funding detection for ailments such as HIV and AIDS. As with other ailments, early detection is a huge positive. Unfortunately, the fact that tests for HIV are free in all government hospitals as well as the pills for patients, it has not dramatically accelerated the desired numbers in persons who volunteer for this test. As a result, an ailment that should not kill us is unfortunately killing so many Nigerians and infecting more unsuspecting loved ones. Mr. Speaker, honorable colleagues, if we compare Nigerians for their own good to conduct frequent tests, especially that they are free and their treatment or management are also free or highly subsidized, we would be creating a healthier nation. When people know that they are all infected, there is a higher likelihood that they will seek treatment. Mr. Speaker, honorable colleagues, we make an effort to solve any problem via a piece of legislation, for example, through enactment of law. Our processes help guarantee that experts in such fields sit to contribute professional knowledge that help to shape the eventual outcome. We should create this opportunity so that together we shall arrive at an effective healthcare law that reduces costs, improves management, enhances the chance for a cure, and leads to a nation where everyone is aware of their health status, at least the chronic or potentially chronic ones. While this bill makes no claim to an exhaustive or subject matter, it is my honest opinion, Mr. Speaker, my honorable colleagues, that the country's Ministry of Health, under the Minister of Health, should periodically articulate for our country a health policy detailing on chronic ailments that shall fall under this bill and require that Nigerian test for. Not only such measure provide data that guides our national and state budget priorities in the health sector. It tells us what health concerns are to attract subsidies. We would have a holistic data on what percentage of population is suffering from what ailment, and we can better advance policies that make budget decisions informed by such data. The question is, how much will this cost? Wouldn't compulsion for tests amount to invasion of privacy? There are several questions about this initiative, but my discussions with other Nigerians leading to the drafting of this bill had these two concerns feature more frequently, if not prominently. Well, HIV tests are already free of charge, so too are drugs. Tests in government hospitals are generally cheap, or several other ailments, and if we were to have a low compulsory testing, we would appropriate more monies for the equipping of government hospitals, sick bays, and test centers so that they are able to carry out these tests for ailments that the Ministry of Health requires compulsory free tests for. The cost on government in the long run will be cheaper. The pressure on our local currency will also be lessened because people will discover their ailments or warning signs early and will not have to travel abroad to seek care or ailments that have advanced due to late detection. Does the requirement that every Nigerian go for periodic tests invade anyone's privacy? Absolutely not. As the results of such tests will be kept confidential, as is currently the case. Indeed, even as we debate this bill, there are hundreds of thousands of Nigerians who are required by firms and other recruiting agencies to first carry out these tests. And these applications have usually carried out such tests. No problems of invasion of privacy. There are even as some of those firms base their final decision to recruit or not on the outcome of such tests. In this case, under this law, for which support is canvassed, only the patient knows their result. The only information shared is whether or not an individual carried out the test or not. It is forbidden for the result of that test to be shared with anyone. Emphasis is on the status of test, which includes tested or not tested. In the end, Mr. Speaker, honorable colleagues, this is a health awareness bill with rippling benefits for the tested and for the country. I believe that we must evolve a system that compares free medical tests for Nigerians, as we will end up with a nation living on drugs that would have been avoided, deaths that could have been averted, costs that could have been lower. To do nothing is not an option. To trigger a discussion on this is one of our patriotic duties as a legislator and to our people. Thank you for your time, Mr. Speaker, honorable colleagues.
Those in favor of the motion say aye. Those against it say nay.